Topics of discussion today, right? But it was the one condition. It was the one condition where I felt just really sad, and I didn't feel a lot of hope. So in 2017, I stepped down from my medical practice in Mission Viejo here to dedicate my time with Alzheimer's. The first thing I did was I started doing health education to the community. And this year I had over 100 events throughout the community. And this is one of over 100 events. Prior to the pandemic, it was 200 events a year. So we're just kicking back up slowly here with that. And I'm doing now today what your doctor cannot tell you in the 15 minutes you have with them. How many of you guys get 15 minutes with your doctor? How many of you guys get less than 15 minutes with your doctor? Did you know that the average primary care physician spends about 7 minutes of face-to-face time? Maybe this is why Alzheimer's is number 3 because of that. I mean, how do you talk about prevention, nutrition, diet, and lifestyle in 7 minutes? You don't, right? Yeah, they don't. By the way, how many of you guys have had a memory test over the past year with your doctor? A couple of hands. This is a diagnosis, guys, that by the time it gets diagnosed, our patient is already in the moderate stage of this disease. We miss entirely the mild stage of Alzheimer's, which can go from 2 years up to 10 years. Can you imagine that? Missing that diagnosis of Alzheimer's up to 10 years. When you can catch it early and be proactive about it, right? Missing that diagnosis. So your doctor don't have the time to spend to discuss the options for lifestyle, nutrition, clinical research, and things that can hopefully minimize and prevent and lower the risk of Alzheimer's, which is why we're here today, right? Now, real quick, what causes Alzheimer's? Many things. I heard the word plaque. Age? Okay. Is it really just age? What else? I heard plaque. I heard diet. Lifestyle. Genetics? Okay. Diabetes? Maybe alcohol? What do you mean maybe? Maybe. Yeah. Red or white? Just kidding. So this is really interesting, guys. How many of you guys have heard of the Alzheimer's plaque? What do we call that plaque? Amyloid? Yes, amyloid, beta amyloid plaque. Okay. We know that this amyloid plaque is something that shouldn't be in there, but it's there for a reason. Right? Why is it there? We know that, by the way, does everyone have note writing material? Yeah. Good. We know that every patient with Alzheimer's, every patient who truly has Alzheimer's have this plaque in their brain. 100%. Make sense? This plaque. It's an abnormal protein that builds up. Every patient. And how many brain cells do we have? Anyone know? A lot? Billions? A healthy person has about 100 billion brain cells, on average. About 100 billion brain cells. A healthy person. That's a lot of brain cells, right? Still less than the national deficit. But 100 billion brain cells. And each brain cell, did you know that every brain cell, they talk to one another? They communicate with one another. They're always chattering and things of that sort. Every time you have a thought and you're thinking of something, your brain cells are connecting and talking, right? Every time you have a feeling, your brain cells are connecting and chatting with one another. Right? Every thought, every feeling is brain cells connecting, talking, having conversations with one another. Every memory that you have is a pattern of brain cells connecting and talking to one another. So my memory of, dinner last night could be maybe this pattern of brain cells over here connecting and talking. My memory of waking up this morning could be this pattern over here, right? My memory of forgetting to turn on the volume could be over here, this pattern of brain cells connecting. Does that make sense to you guys? Right? And so our brain cells, they're always talking. Maybe you have 100 million of them. They're always connecting with one another. What happens is the plaque gets in the way between the brain cell's ability to talk and connect. Gets in the way between the brain cell's ability to connect and talk to one another. And in the beginning, when there's only a little bit of plaque, no big deal, right? The brain cells kind of go around it and all that. When our memory loss is only mild, forgetting a word, a name, right? Walking into a room, wondering why you're here. Anyone relate?
Yes.
Right? No big deal, mild symptoms, right? What happens is, as the plaque burden gets worse and it builds up over time, the memory starts to get worse and worse with that. So we have seen a correlation between this plaque and memory loss, okay, with that. So if you have Alzheimer's, 100% plaque is there. If the plaque is not there in your brain, if the plaque is not there, you do not have Alzheimer's. 100%. Does that make sense? If the plaque is not present in your brain, you do not have the diagnosis of Alzheimer's. You may have dementia for other reasons, right? You may be forgetful for other reasons, but it's not Alzheimer's. The plaque is required for the diagnosis. Does that make sense so far?
Yeah.
And then there's not just plaque, there's what we call the tangles. Everyone heard of the tangles? Right? What do we call the tangles, guys? Tau tangles, T-A-U, right? Tau tangles. That's also an abnormal protein that gets misfolded in your brain cells. And we know that tau tangles, they're there as well. Right? If there's plaque, there's usually tau. Plaques and tangles, amyloid and tau. Make sense?
Yes.
And so the big debate is this. Does the plaque cause Alzheimer's? Or is the plaque a result of all the factors that leads to Alzheimer's? Chicken or egg? Right? What do you guys think? Chicken or egg? Yeah, I heard results. So is it the egg or the chicken? Only God knows.
That's a good answer.
We're in church? We can pray about it. Yeah. To tell you the truth, we don't know. We're trying to figure that out in research right now. How many of you guys would be interested to know if the plaque's even there in your brain? Wow. Why would you want to know? Aren't you scared? I mean, why would you want to know? I'd be freaked out. No, why would you want to know? What would you do if you knew? You can plan? What kind of planning? What will you do? Oh, you're going on a road trip? Treatment? Yes, treatment. There's so in clinical trials, right? The clinical trials that we do here at Irvine Clinical Research, these clinical trials are designed to remove plaque, right? They're designed to remove plaque. And yes, we can remove plaque. I mean, it's been published. How many of you guys would like your plaques removed if it was there? Right? If that's the case, go see Irvine Clinical Research, right? That's what we do in clinical trials. with that. What else would you do? What other planning would you do if you knew the plaque was there? Diet, you would change your lifestyle. Okay. What else? Maybe financial planning?
Yep.
Right? Definitely. Maybe you'll take a second look at the will and see whose name to cross out. Who knows, right? Whose name to add back on. Financial planning. So yeah. So why not plan now when you still have this, then wait for somebody to plan for you?
Right.
Does that make sense?
Yep.
How many of you guys have already had that plan made out? That's not enough hands in here, guys. That's not enough hands in here. Right? Why not plan when you still have this and wait for somebody to plan for you? Right? If you haven't had your advanced directives and all that taken care of, make sure that's taken care of. Right? I know Alzheimer's Orange County does these lectures on advanced directives and posts and things of that sort of need help with that. But these are some of the things that maybe you could be proactive to do if you knew that the plaque was there. Right? Now, really cool stuff, guys, from research being published and presented over the weekend at the Alzheimer's Association International Conference. By the way, how do you detect the plaque? How do we detect this plaque? Biopsy? Autopsy? I mean, if you were to ask me 10 years ago how to find this plaque, how do you confirm the plaque? It was autopsy. Yeah, it was autopsy. It just wasn't a good prevention plan back then. We had to wait. It was autopsy. Absolutely. Over the last few years, guys, we now have FDA-approved brain scans. Does anyone know the name of these brain scans? PET scans. Yes. We have FDA-approved PET scans that can identify a plaque. How many of you guys would be interested in something like that? I'll give you good news, bad news. The bad news, the bad news is that insurance doesn't cover it. Nothing new there, right? Something preventative, oh, why cover it? I don't know. That's assuming there's any prevention yet, right? But we'll be talking about that. But there's no insurance coverage. Medicare doesn't cover these brains, this FDA approved but not covered by Medicare. That's interesting. So these PET scans that will identify the plaque in your brain. We have scans that will look for amyloid. We have scans that will look for tau. So that's the bad news. There's no insurance approval. The good news is if you're part of a clinical trial and you're a candidate, right? If you're eligible and you meet the criteria to participate, many of our clinical trials offer these scans for you at no cost. With that. Does an MRI show the amyloid? Unfortunately not. Only PET scans. So we are doing PET scans in clinical trials if you're a candidate for these clinical trials. We have clinical trials called the Alzheimer's Prevention Clinical Trial, where you can have, so we have other clinical trials for those who have mild memory loss, mild Alzheimer's, and things of that sort. So all kinds of different clinical trials that will offer these brain scans at no cost if you're a candidate for the clinical trials, right? Here's something interesting though. My guess is in the next 5 years, we will have an FDA-approved blood test.
Oh, nice.
Not yet, but it's coming. Over the weekend at the Alzheimer's Association International Conference, we were presented with data, with information on what we call biomarkers. Right? Anyone heard that term, biomarker? Right? A biomarker is a surrogate of the disease, right? So a biomarker for dementia, right, Alzheimer's, would be the amyloid, right, to detect the disease. But we have now blood testing in research. We have clinical trials in research where if you're a candidate for that clinical trial, you get to get a blood draw that will tell you if the tau tangles are there. Simple blood test. How many of you guys would be interested in that? Okay. Irvine Clinical Research, right? We have that study where, and you have to say Alzheimer's prevention clinical trial. That is the clinical trial where you get a blood test if you're a candidate for the trial, where we draw your blood in a few weeks or so. We will let you know if you have the tangles in your brain or not. That'd be nice information to know, right? Because if you don't have the plaques or the tangles, whether on a brain scan or a blood test, then at least you can take that off your list of worries. How many of you guys would like to take that off your list of worries? This is how you do it, right? This is how you do it. And the question is, what if it is there? Right? What if we scan your brain and there's plaque or there's tangles? What can we do then? So before I talk to you about treatment options and things of that sort, let me ask you this. What causes amyloid plaque? What causes these plaques to form? Can you guess?
Eating habits.
Eating habits? Like what?
Processed foods.
Processed foods?
Cholesterol.
Fried foods? Okay. Boxing injuries? Ooh, yeah. Traumatic brain injury is a risk factor for Alzheimer's. Yes? Yes. Lack of sleep. Stress. Hearing a lot of different things here. Why do I worry? It all falls on the categories that I'm part of with that. Right?
Inflammation.
So, I heard inflammation. So you guys been in my lectures before. So, there are over 30 different factors. Over 30 different factors that have been attributed and associated with plaque production. Over 30. And so, rather than giving you 30 different things to write on your notepad because you're run out of space, and because I don't remember all of them, right? I'm going to give you 3 different categories. 3 different categories where these 30 different factors belong to. I call them buckets. Like 3 different buckets that catches, amyloid plaque. Does that make sense?
Yeah.
Let's talk about that a little quick. Because if you understand the categories and the buckets, then you'll understand the lifestyle you need to minimize your risk for Alzheimer's. Make sense? Mm-hmm. By the way, article just published this past week showing that in several hundred patients who were put on an exercise program over a period of a year or so, and these patients were diagnosed with mild memory loss, MCI, right? That's pre-Alzheimer's. They were put on a regimen of exercise for about a year. And if you understand what MCI means, mild cognitive impairment, a number of patients, before you go to Alzheimer's, you have to have MCI. That's like pre-Alzheimer's, right? MCI is like pre-Alzheimer's. We know that MCI, a portion of that every year, a certain percent of folks head to Alzheimer's. That study published just this past week or so showed that those who put on an exercise program for about a year did not lose their memory at all a year later. Compare to those who normally have MCI program. Isn't that interesting? Isn't that hopeful? Right? There's hope here, guys. This is why we're here. I'm not just here to tell you bad news and leave, right? So the 3 buckets of plaque production. Bucket number one is the circulation bucket. Circulation bucket. What do I mean by that? any condition that causes poor circulation to your body, to your heart, the poor circulation does not stop at the neck, right? Increases the risk of Alzheimer's. So if I took 10 patients with Alzheimer's, 8 of those 10 have high blood pressure. Okay? Because high blood pressure is a circulation problem, isn't it? If I took 10 patients with Alzheimer's, 4 of those 10 have diabetes. And you're wondering, what does diabetes have to do with circulation, right? Diabetes is a blood sugar problem. And the question is, why do diabetics die? What do diabetics die from? Diabetics die from heart attacks and strokes. The end result of diabetes is circulation problems. This is why if you're diabetic, your risk of Alzheimer's is double. And this is a little scary, guys, because in the United States, 2 out of 3 of us have either diabetes or pre-diabetes. In the United States, 2 out of 3 of us have either diabetes or pre-diabetes. That's determined from a blood test. Anyone know what the blood test is called? Hemoglobin A1C. Anyone ever heard of that? Yes. You guys get it checked? Sure, right? So there's a hemoglobin A1C range that if it's above 5.7, right? 5.7 to 6.5, you're pre-diabetic. 6.5 and above, you're diabetic, right? 2 out of 3 Americans have a hemoglobin A1C that's above 5.7. That's a little scary because you double the risk of Alzheimer's with that. Okay? So 10 patients, 8 out of 10 have high blood pressure, 4 out of 10 have diabetes, 3 out of 10 have heart disease, and many, many have high cholesterol. Because what does cholesterol do to our circulation? Clogs it up. Does that make sense so far? That's a circulation bucket. What's interesting is that the circulation bucket is everything that leads to a heart attack, right? Every condition that leads to a heart attack, poor circulation, they're the same conditions that lead to Alzheimer's. So if you want to lower your risk for Alzheimer's, then you lower your risk for what? For heart disease. Make sense? That's bucket number 1. By the time we finish bucket number 3, we'll kick the bucket. I'm just kidding. Maybe not. Sorry. Semi-professional lecture here, right? So, yeah. I don't even have slideshows. So anyway, that's bucket number 1. Bucket number 2 is the inflammation bucket. Inflammation bucket. What does that mean? Is inflammation a good thing or a bad thing, guys?
Bad.
Mostly bad, I heard some good. Is it all bad? I mean, what is inflammation? How do you define inflammation? What is inflammation? Irritation, fluid? Okay. Inflammation, okay. How many of you guys have had the flu before? What is one of the first symptoms of the flu? Fever, yes. Did you know that fever is simply inflammation? Yeah. Fever is when your body gets inflamed, it heats up, so you have a fever, right? Why does the body get inflamed? The body gets inflamed because it's fighting, right? Your immune system is fighting the flu virus. In the process of your immune system fighting the flu virus, in the process of this battle, the byproduct of the battle is inflammation, which is why you have the fever. Make sense so far? Inflammation is any time your immune system sees something in your body that is threatening. Flu virus, COVID, right? Toxins, pneumonia, right? Anything that shouldn't be in your body, the immune system fights it. Any toxin, any bacteria, any fungus, any virus, anything that shouldn't be in your body, your immune system attacks it, and in the presence of fighting, right? The immune system attacking something that shouldn't be there, inflammation is created. Does that make sense of what inflammation is for you guys? Did you know that inflammation is the core of most diseases today? It is behind most diseases today. Think of the organ systems we have today. Think of the diseases of the organ system, and I bet you I can tie it somehow to inflammation. Like for example, your lungs. Your lungs, right? What are some conditions of the lungs? Health conditions. Pneumonia, obviously, right? COPD is simply inflammation of the alveoli sacs. COPD exacerbation, inflammation of the alveoli sacs in the lungs. Okay. Asthma. Asthma is simply inflammation. It's when your immune system does not like something that you've been exposed to, like exercise-induced asthma, smelling of perfume, right? Cold-induced asthma. Your immune system doesn't like it. It produces inflammation, which causes mucus production, which is a byproduct of inflammation, and then you start to wheeze. So wheezing is just a symptom of inflammation. Does that make sense so far? So asthma is inflammatory. COPD is inflammatory. Bronchitis is inflammation of the bronchial tubes, isn't it? Okay? COVID. Why do patients die from COVID? Right? I'm in the ER every week admitting patients. The number one reason we admit a patient to the hospital when they have COVID is COVID pneumonia. Now here's the thing, guys. The virus doesn't kill you. It is the immune system's response to attacking the virus and producing excessive inflammation that kills you. COVID pneumonia is simply fluid buildup in your lungs from the inflammation that is created as the immune system is trying to fight COVID. That's all it is. Right? As the fluid builds up, you can't breathe and your oxygen level drops. Makes sense so far? Inflammation is behind that. Right? And that's just your lungs, guys. Whether it's COPD, emphysema, asthma, infections, bronchitis, inflammation is behind all that, isn't it? And that's just one lung system, right? One system. What about the GI tract? What are some health conditions of the GI tract? Right? How many of you guys have heard of Crohn's disease? Did you know that Crohn's disease is simply inflammation? Right? It's simply inflammation of your GI tract. Have you heard of ulcerative colitis? That's just inflammation of your colon. Acid reflux, right? GERD is simply inflammation from excessive acid, right? That lines up your stomach, your esophagus. All inflammation. Pancreatitis, inflammation of the pancreas. Hepatitis, inflammation of the liver. Are you starting to see a trend here with inflammation and diseases? That's just the GI tract, right? What about inflammation of the skin? What do we call that? Dermatitis. Psoriasis is inflammation of the skin. Eczema is inflammation of the skin. Dermatitis is inflammation of the skin. Are you starting to see more trends here? Every condition we name is driven by inflammation somehow. What about the joints? That's pretty obvious, right? All kinds of arthritis isn't there. There's rheumatoid arthritis, osteoarthritis, psoriatic arthritis, there's gout, right? All kinds of arthritis, all driven by inflammation. Isn't that true? What do you call inflammation of the brain?
Encephalitis.
Encephalitis. I call inflammation of the brain Alzheimer's. Yeah. I call inflammation of the brain Alzheimer's. How do we know that? We know that because every time we do an autopsy of a patient with Alzheimer's, not only do we see the plaques and the tangles, but all around the brain cells is inflammation cells. Right? Inflammation is bucket number 2. Make sense so far, guys?
Yep.
It's getting more depressing, isn't it? Bucket number 3. Toxins. Toxicity. Give me some examples of toxins. Anyone know? Pollution? Yeah. Did you know that if you live in an area of high pollution, your chance of getting Alzheimer's is higher than someone who lives in an area of lower pollution? Absolutely. That's toxins, right? Except it's toxins from the air. Absolutely. What are some other examples of toxins? Artificial stuff? Processed stuff? Yeah. Unfortunately, how do you escape from that? I mean, everything in the label that we read today, I don't understand half of the label. Right? How many of you guys know what I'm talking about? You look at the label of like food, right? Food, and you're like, I don't even know what's in half of that stuff because I don't recognize it. It's all chemical names, right? Toxins. How many of you guys are like me where you enjoy a medium rare steak? That's it. You guys vegetarians? Right? So when you're eating your medium rare steak, are you just eating a medium rare steak? No? So why not? What else are you eating? Huh? Oh, she's saying you're eating whatever the cow ate. Absolutely true. Right? What do we pump into our cows? Why would we pump antibiotics into our cows? So they don't get sick and die, right? That's true. Yeah, throughout the lifespan of our cows, they're pumping antibiotics because who wants a cow that gets sick and die? No profit. Right? So think about it. When you're eating your medium rare steak, you're not just eating a medium rare steak. You get antibiotics you may be eating. What else do we pump into our cows? Hormones. Yes. Why would we pump hormones into our cows? Bigger, fatter, more profit. Right? You sell them by the pound. We might eat by the pound. Bigger, fatter, more profit. Right? So when you're eating your medium rare steak, you're not just eating a medium rare steak, are you? You get antibiotics, you get hormones. What else? What about the grass that the cow ate? How do you know that grass was not sprayed? Do you? Does it tell you on the label? It doesn't? Why would they tell you that? Right? How do you know you're not eating pesticide that the cow ate? Herbicides, pesticides, insecticides. Right? How do you know? Do they tell you? Right? Of course it's grass-fed. But was the grass sprayed? I don't know. Right? It's good marketing. I just don't know. And so when you're eating your medium rare steak and it's being digested and into your bloodstream, your immune system is like, hey, what is that? Is antibiotic floating around? A pesticide? There's some hormones floating around. What does the immune system do when it sees something that shouldn't be there? It attacks it, right? And in the process of this attack, what is created, guys? Inflammation. Are you starting to see the connection here? between Alzheimer's and our life and our lifestyle choices. We truly are what we eat, right? We truly are what we eat with that. And so I'm here to let you know, really, that we actually eat ourselves to our diagnosis.
Sad.
We eat ourselves to diabetes, to obesity, to cancer, and to Alzheimer's. Crazy, isn't it, when you think about it? And here we are looking for that special pill to take, right? To treat these conditions. But these are the three buckets. These are the three buckets that lead to more plaque, right? These are the three buckets that lead to more plaque. I want you to imagine something with me, okay? We're going to do a little imaginary journey here, real quick. What I want you to do is imagine that you have a house and your brain is sitting in the living room. So you got this big brain in the living room of a house, right? The house has a roof on top, and here's your brain in the living room. Can everyone imagine that? Right? Big brain sitting in the living room. And outside, it is raining. It is raining outside. But it's not normal rain. Right? Every raindrop is a raindrop of high blood pressure, diabetes, medium rare steaks, air pollution, toxins, right? And that rain keeps dropping on the roof of your house. What happens to that roof over time, guys? It starts to leak, right? It starts to leak. And in the beginning, it may just be one leak, right? One little hole in the roof and the raindrop comes down. But the rain keeps coming, it doesn't stop. It doesn't stop, and over time, second leak, third leak, fourth leak. When a patient comes to my office, the primary care office, and says, Doctor, I have memory loss. Or the patient's loved one drags them in and says, Doctor, he or she has memory loss. I open up their medical records, right? I open up their chart. And all I see are multiple leaks in their roofs already. I see hypertension, diabetes, obesity, bad diet, lack of exercise. I see multiple holes. The roof is already so damaged that I make the diagnosis of Alzheimer's at the moderate stage of the disease because the roof is too damaged. Does this make sense to you guys? This is what's happening today in Orange County. By the time a doctor makes that diagnosis of Alzheimer's, there are way too many leaks in the roof to try to plug up. I mean, what do I try to plug up first? This hole or that hole? Right? The damage has already been done. And because I've seen this in close to 20 years of medical practice, right? That's why I stepped out and stepped away from my practice to come and do this. You need to learn how to fix your roof and protect it. Does that make sense to you guys? And guess what? Everyone's roof is different. Right? You may have high blood pressure, diabetes, but you may have some genetic issues and bad diet and pollution. And everyone's roof is different. When an Alzheimer's patient walks in with a diagnosis of Alzheimer's, that's just one Alzheimer's patient. They don't have the same leaks as somebody else. Does that make sense? To fix Alzheimer's, we need precision medicine. We need to identify the specific leaks in your roof, including genetics, to have a program to fix that. It's not one pill fix all. Does that make sense? If it was one pill fix all, we would have had that pill already, wouldn't we? Do you know how many clinical trials we have had over the last 2 decades for Alzheimer's? How many clinical trials in Alzheimer's have we done in the last 2 decades? Over 400. What is our success rate? Or what is our failure rate in Alzheimer's clinical trials?
100%.
Over 400 trials done over the last 2 decades, our failure rate is 99%. And I ask you why. Why is it that we can find a medication to treat diabetes and improve it? Why is it that we can find a medication to improve cancer? Why is it that we can find a medication to lower your risk for heart disease and stroke and not find a medication for Alzheimer's? 400 plus failed clinical trials. Why? Because you can't fix multiple leaks with one pill. Does that make sense?
Yes.
It's not for the lack of trying, guys. It's not for the lack of trying. I mean, I represent a clinical trial organization here, right? There's hope down the road. How do I know? I see the pipeline. I see the pipeline, right? So how do we fix this? How do we fix this? Address the 3 buckets to avoid bucket number 4, kicking the bucket. Right? Right? Address the 3 buckets. Absolutely address the 3 buckets. Okay? There's hope down the pipeline. So, does everyone know about that FDA-approved medication last year for Alzheimer's? You guys heard about it? Anyone know the name of it?
Aduhelm.
Do you want it? Oh, Aduhelm, right? Aduhelm, it is a Biogen, is the pharma company, and there's a lot of controversy behind that medication, right? You guys heard of the controversies behind it? Well, first of all, it was really expensive. It was $56,000 for a year treatment. Right? Granted, they cut it down to half after that. After everyone complained. Right? But Aduhelm did not reverse Alzheimer's. Aduhelm did not prevent Alzheimer's. Aduhelm did not stop Alzheimer's. Why was it FDA approved? Why did the FDA approve it though? If it didn't reverse, stop, or prevent Alzheimer's? They get paid? What? Are you saying the FDA is tainted? Right? Yeah. Here's why. Here's why. Compared to the placebo group, right? We have the treatment group and the placebo group. Aduhelm bought some time. It slowed down the progression in one of the studies, in one of the 2 phase 3 studies. It slowed down the progression of memory loss by about 20%. It bought some time. Now, some of you guys may be like, why did they even approve it if all it did was help 20% by buying some time? Does that make sense? Why did the FDA approve it? The FDA, here's the other thing it did. It removed plaque. It successfully removed plaque. Yes, that's good, right? It successfully removed plaque. It bought some time, not a lot, it bought some time. It was approved because what is the price tag of buying months to years if it was your loved one? If it was your husband or a wife, What is the price tag behind buying additional time so that they can remember you, so that they can experience life with you? Right? How can you put a price tag on that? And we have 6 million Americans today with the diagnosis of Alzheimer's who cannot wait for another 5 years for something else to come out. That's probably why it was approved. We have 6 million Americans with a diagnosis of Alzheimer's today who want a little bit more time. Does that make sense to you guys? Medication does not work well, doesn't stop Alzheimer's, yes, it removes plaque, doesn't reverse Alzheimer's, doesn't prevent Alzheimer's, it gave some more time. And there are 6 million Americans who cannot wait for another few years. Because by the time that happens, in another few years, they will really be out of luck. Does that make sense to you guys? Right? So,
there's something in that medication that helps reduce plaques, so I was figuring out what to do.
yes, how does that medication reduce plaque? Does anyone know? Really interesting. Have anyone heard of the term immunotherapy? Of course, right? Immunotherapy. Immunotherapy is being used in cancer treatment all the time, right? For patients who have cancer. And in cancer treatment, what we do is we give the immunotherapy, which is antibodies, right? And the immunotherapy would go and find the cancer and tag it and light it up so that your immune system can see it. And the immune system goes in there and gobble the cancer cell. Make sense? Immunotherapy. And because of immunotherapy, patients are living longer today with cancer. and I was taking care of patients at Memorial Care, I've had stage 4 breast cancer patients alive for over 10 years. Stage 4, mets to the bones because of immunotherapy. A lot of success in that range, right? Addressing the immune system to fight cancer. What we do in clinical trials at Irvine Clinical Research, is we have taken immunotherapy and rather than target it to cancer, these immunotherapy can identify and tag plaque. Lights up the Alzheimer's plaque so that your immune system go in there and gobble Pac-Man. Does that make sense? Does that give you some hope? That's offered at Irvine Clinical Research. Immunotherapy is one route we are going. So, here's what I found out. There are currently, take a guess. How many medications are being evaluated in clinical trials today for Alzheimer's? Anyone know? How many medications are being evaluated today, being tested in clinical trials for Alzheimer's? I heard 0 and hundreds and thousands. There is, as of this year, and this was published, by the way, I think in January, by Dr. Jeff Cummins, who is like the Alzheimer's expert in the world, right? When he published his report this year, around January, there was 140-something different medications being tested for clinical trials. 140-something. Imagine if only a few of those, right, come through. It's a lot of clinical trials going on. It's not without lack of trying. Isn't that true? Do you guys understand the different phases of clinical trials? Yeah. Right? But you got to go through phase 1, phase 2. Like in a clinical trial, everyone understand the concept of clinical trials. Right? Understand the concept of clinical trials. From the time a mad scientist thinks of a medicine to the time the FDA approves that medication, 10 to 12 years. 10 to 12 years. It needs to go through the preclinical stage where we test that medication first on rats, animals, mice, right? If it looks good in the preclinical animal phase, then we transition it over to people. Right? Phase 1, phase 2, and phase 3. 3 phases that this medication needs to go through and pass successfully before it can even go to the FDA to ask for approval. And if you think of it, each phase is probably about 3 years or so-ish, right? Phase 1 is around 3 years, phase 2 is around 3 years, phase 3 is around 3 years. That's how you come up with like 10 years, right? I'm giving you broad estimates with that. In phase 1, we look for anything super dangerous. We check for major side effects in phase 1. We tested it in healthy people, right? This medication. And so, are you growing a third eye? Are you growing a tail? Are you dropping dead? Is there anything super dangerous that needs to stop at phase 1? Make sense so far? And we monitor for side effects. If there's nothing super dangerous that stops you at phase 1, you move to phase 2. Phase 2, we tested in more people than phase 1. Right? Larger population of patients, of volunteers in phase 2. Phase 2 is where we look at the different dosages. Does this medication work better at dose 10 milligrams, 100 milligrams, 1,000 milligrams, 50,000 milligrams, right? We look at different dosages, and we continue to look for side effects. If you pass phase 2, and you're able to identify maybe the dosage that works best in phase 2, then oftentimes we'll take that to phase 3. Phase 3, you're looking at hundreds to thousands of volunteers now. Hundreds to thousands of volunteers. Okay? And in these clinical trials, it's usually double-blinded. There's always a placebo group versus the test group. Makes sense? Right? In all of our clinical trials at Irvine Clinical Research, there's always a placebo group and a test group. So in phase 3, if your results from the test group is better than the results of the placebo group, showing that it's effective, right? And if you statistically it looks good, there's no serious side effect to stop it, and it succeeds, then you take that medication to the FDA for approval. So a medication can die at any stage. Does that make sense? A medication can stop and die at any stage. This is probably why new medications are always super expensive.
Exactly.
Because the pharma companies trying to recoup all their losses at the earlier stages and all the medications that didn't work out, right? And so the success rate of Alzheimer's medication, well, let's say the failure rate has been 99%. Right? But I can tell you from seeing what's in the pipelines now, that the medications in the pipeline looks a little bit better than the medications we have today. What are the approved medications we have today for Alzheimer's, guys, besides the one last year? What are the other ones? Namenda, Aricept, Exelon patch, right? So there's several medications already approved. How many of those medications, Namenda, Exelon patch, Aricept, how many of those medications remove plaque from the brain? 0. They only treat the symptoms. They buy you some time, right? This is why the medications we have in the current pipeline is trying to not just patch up the symptoms. We're trying to address the potential causes. That includes removing plaque with that. So Aduhelm, which was approved last year, not that great, right? 20% difference in slowing down memory loss, is the first medication approved that actually removes plaque. Do you guys remember the first cell phone out? When was that? Was that the 80s or 90s? 90s or 80s? 90s? Okay. So what did it look like? Like it was big, right? It was big, it was bulky, it was expensive. And did it work well?
No.
No. Right? The first cell phone, it was big, it was bulky, it didn't work well, it was very expensive. Right? Look at our cell phones now. Right? With this cell phone, I can look on here and I can tell you what my blood sugar looks like right now. What is my blood sugar? 108, not too bad, 108, right? I'm monitoring my blood sugar right now with this cell phone. And so we can do everything with our cell phone now. It has advanced over the years from the 90s, right? So I want you to think of last year's approved medication, Aduhelm, as the first cell phone. Because every cell phone that came after that improved. Isn't that right?
Yeah.
We have the first medication, guys, last year that can remove plaque. And I'm looking at the pipeline. I'm hopeful. I'm hopeful that each new medication that comes out is going to buy more time, 6 months, a year, more time, and hopefully at some point prevent. Does that make sense to you guys? Are you hopeful?
Yes.
Absolutely. Absolutely. The next phase, I'm going to tell you all the treatment options. Sound good? You have to disclose that to your insurance. And the answer is no. It's just your information, unless you want to let your doctor know. But other than that, the information you have is confidential. So a great question, because there's sometimes like a little stigma of concern, right? Like, is somebody going to pull your license or things of that sort? But in clinical trials, the answer is completely confidential. What are you guys eating? Is it brain health food?
Yes.
I don't know about that. Orange looks good. Orange looks good. Yes. Everyone had a good break?
Yeah.
Did you check out the different sponsors and vendors we have? Yes. Somebody just gave me some CBD oil. Rub it on for, I don't know. So, cool. Thank you. Dr. Peggy CBD oil. Dr. Peggy is actually in Huntington Beach, right? She's a pharmacist who specializes in CBD. Anybody ever had questions about CBD before? You have a pharmacist standing right here who specializes in it. Maybe after the talk, yes, which Dr. Peggy is. Yeah, thank you. Cool. I'm going to start rubbing it on you. So, real quick here, how many of us felt really secluded during the pandemic? Yeah, right? Mental health was a big factor during the pandemic. And I've seen it in many patients. During the pandemic, I did a lot of Zoom calls just to kind of keep our folks engaged and not so lonely. How many of you guys were part of my Zoom calls during the pandemic? Oh, wow, that's a good number of hands here. Yeah, once you get on my little email list, you can participate in Zoom calls when we do these online talks with that. But did you know what happened to Alzheimer's during the pandemic? Is there a relationship? What happened? Worsening? Yes. Our patients with Alzheimer's were even more isolated. They couldn't spend time with family, friends. They were stuck, and without that engagement, they were in trouble. As a matter of fact, during the pandemic, when a patient with Alzheimer's actually caught COVID, what we noticed was that the death rate was much higher in an Alzheimer's patient compared to a non-Alzheimer's patient. Possibly because they're older, and so they're more at risk. The other thing we noticed was that the decline of their memory was faster when they got COVID and got sicker. They had a faster decline in memory. So in the course of Alzheimer's disease, if your memory loss was going down slowly and slowly over the years, then you caught COVID, it went down like, woo, really much faster, is what we have noticed. How many of you guys have heard of post-COVID brain fog?
Yeah.
Anyone know someone who had post-COVID brain fog? Really? What was it like for them? Fuzzy? They couldn't concentrate. I met a few patients who caught COVID and they couldn't concentrate. They dropped out of work and they still weren't working after a year. They got this brain fog with that. And their memory was poor. And I don't know. I mean, I got brain fog without COVID. Some of us have brain fog without COVID, right? But what kind of symptoms? Memory loss, poor concentration, feeling like their brain is fuzzy, right? Are there different symptoms? How does COVID affect the brain? I mean, why does COVID cause brain fog? Inflammation, right? We know COVID causes inflammation. We know inflammation is a driver of all types of brain conditions, not just Alzheimer's. Inflammation is a driver for Parkinson's, multiple sclerosis, other brain neurodegenerative disease, right? Inflammation. So that's one factor. How else does COVID cause brain problems? Anyone else? Huh? Lack of smell and taste. How many of you guys have known people who've lost their taste and smell? Wow, what a weight loss program, right? And even after the COVID is gone, it hasn't come back yet. In many of my patients, it's been a year, their smell has not come back. Zinc twice a day? Really? Okay. You lost yours for 6 months. Interesting. Anyone experience loss of smell from COVID? You did? Long time? Taste, smell? How long? It's been months. Has it gone back? It came back? Good. Yeah. So talk about smell. What nerve in our brain helps with smell? Oh, we got some medical people here. Got some medical people here. By the way, you guys know that this lecture we're doing, there is CEUs for the nurses, right? Yeah. Anyone sign up for CEUs? Oh, good number of hands here. Yeah, we're giving continuing education units for our nurses here. Hopefully the data is legit, right? For the CEUs. But yeah, we're giving 3 units of CEUs for nurses. So there's a nerve called the olfactory nerve. That nerve starts where? In your brain. And that nerve goes from your brain to where? Where does the nerve go to? If it starts in your brain. Well, what do we smell with? That's right. So the nerve travels from your brain, it travels down to your nasal cavity. Right? So the nerve is connected from the brain to the nasal cavity. And that nasal cavity, what happens is you see the little roots of the nerve dangle in your nasal cavity. Right? So the nerve root that affects smell, the olfactory nerve, is dangling in your nasal cavity. And that's why we smell with our nose, because right, the aroma goes in our nose and it's touching the nerve roots, and that nerve root takes the smell up to the brain, and that's how you smell. Make sense so far? So, let me ask you this. During a pandemic, what other virus comes through your nose? COVID, right? I mean, in order for COVID to get to your lungs to cause COVID pneumonia, it must go through where first? Right? You breathe it in. That's why we, wear a mask during the pandemic and all that, so that you're not breathing in stuff that people are coughing at you and so that sort, right? We wear that to protect it. So COVID's first location is that it goes through our nose or our mouth. Comes through our mouth, most of the time it dies. comes through our nose, nothing's stopping it, right? So it comes through your nose and then eventually comes through your lungs, causes COVID pneumonia. I admit you to the hospital in the ER, and that's how patients die, right? But when it gets to your nose, the virus is in your nose. What is it exposed to that's dangling around? That virus is exposed to the little roots of the olfactory nerve. And so the virus meets olfactory nerve, right? COVID meets olfactory nerve, and guess what? It goes up the nerve. Goes up the nerve, right? As COVID goes up your olfactory nerve, it is destroying the nerve. As it destroys the olfactory nerve, you lose your sense of what? All right, are you all making the connection now? That's why one of the principal first symptoms of COVID is loss of smell, which is connected to taste, right? But the virus doesn't stop there, does it? Because now it has a pathway to your brain, doesn't it? Directly. Do you understand post-COVID brain fog now and the connections? Right? Real problem, real disease, and I just showed you the anatomy of how that works. This is why people lose their sense of smell. The virus goes into the nerve, which is dangling in your nose, which is why we wear a mask, right? If you're at risk or if you're not vaccinated, stuff of that sort, so that it doesn't go to your brain and cause post-COVID brain fog, in which some people are still affected a year later. Right? Serious problem, guys. COVID. It's not about the death rate, it's about what happens after you catch COVID. Long COVID syndrome that we are still learning about. We're still learning about such a new virus that we're learning about all these different long COVID syndrome. So I would say 20 to 30% of patients who have caught COVID at any stage, it could be completely mild, can still have post-COVID brain fog. We just don't know how long it lasts. What we do know, and this has just been published as well over the last few months, is that in the brains of patients with COVID, we do these brain scans to find out how COVID affects the brain. Those with post-COVID brain fog, we see what's called microhemorrhages, little small spots of bleeding in the brain on our brain scans in clinical research. And this is how COVID affects your brain, right? And it affects the areas that affects memory. This is why people have memory loss with post-COVID brain fog. Does that make sense to you guys? Right? Serious infection with that. Inflammation's connected, right? Olfactory nerve is connected, bleeding in the brain, microhemorrhages, which we can identify on brain scans connected. Yeah, it was really bad, guys. I was admitting patients in the ER every week throughout the pandemic as one of the doctors in the ER when I was on call. And it was really bad. I'm just glad that we're kind of over well, we're not over it, are we? COVID? Yeah, what is the latest variant? BA5 or 5 going on 6 or something like that? Going on 7, right? So the latest variant is the most contagious variant. Of all the variants we have, the latest variant is the most contagious variant. Bad news, not good. But the good news is I'm not seeing a lot of patients in the ER these days with COVID. I'm seeing a slight uptick, but nothing compared to a year ago. Part of that is because most of us are already immunized one way or another. We're immunized because we've been vaccinated, or we're immunized because we caught it already, right? So most of us have already had some kind of immune system in vaccination. Everyone here vaccinated? Right? It's good, right? Either through vaccination or through previous infection, right? We've already had some kind of immunity built up. So I believe because of that, when you catch this latest variant, you're not landing in the ER these days because you have some sort of immunity already from either vaccination or previous infection. Make sense so far? The next booster is coming out, probably within either September, October or so. The latest booster, I do recommend it because this booster is one that is designed specifically for Omicron. The latest variant, the Omicron variant, right? The boosters you've had so far was designed for the original COVID virus way back 2020, 2019, right? So the original booster is designed for that. So they are tweaking the booster specific for this variant. So beats landing up in the ER seeing me, right? So definitely a strong recommendation once that comes out because it's specific for Omicron with that. Okay? Now, let's chat real quick on some things you can do to minimize your risk for Alzheimer's. Sound good? There is a journal called The Lancet. Anyone ever heard of The Lancet? It's English, British medical journal, kind of like the Journal of the American Medical Association or the New England Journal of Medicine, right? Which most of us docs read. There's a journal, The Lancet, that published a really important article that came out during the pandemic. And because it came out during the pandemic, we were all worried about COVID. Nobody noticed the article. It came out in 2020. And that was a review of strategies for Alzheimer's. And the journal in The Lancet came up, based on the data that's been published, based on research, came up with 12 different modifiable risk factors that if you were successful in modifying these risk factors, can either reduce or prevent Alzheimer's by up to 40%. Sounds good? Without taking a pill. Right? Sounds even better? Because I know I got in here in my little flyer here. I gotta look at it to see what I'm supposed to talk about. Right? The 9 pillars of brain health. So because you're here today, we're going to give you an extra D pillar. The 12 bonus, right? With that. But before I talk about that, I want to talk to you about what a physician does when you come to them and talk about your memory loss to do a workup for Alzheimer's. What testing you should get, what blood tests you should get, things of that sort. Sounds good? So you're aware that there are many other conditions that can cause dementia besides Alzheimer's, right? If you took the umbrella of dementia, right? So dementia is like one big umbrella of just memory loss. 2/3 of the umbrella is Alzheimer's disease. So Alzheimer's take up 2/3 of the dementia umbrella, but there's another 1/3 of dementia that's non-Alzheimer's dementia. Anyone know what that 1/3 is? What conditions can cause memory loss? Parkinson's, Lewy bodies, what else? Vascular dementia, frontotemporal dementia, dementia from having a lot of strokes, right? Dementia from strokes, delirium. You can have memory loss from a deficiency of vitamin B12. We call it vitamin B12 induced dementia. Did you know that? How many can get your B12 checked? Nobody, right? You can have memory loss from hypothyroidism untreated. Did you know that? Hypothyroidism. Anyone here get your thyroid checked on a yearly basis? Just a few hands, right? Did you know you can have memory loss from side effects of the medications you take? Does your doctors review that with you to see if memory loss can be part of why, the medications you take? Right? Polypharmacy. Too many meds interacting with each other can cause memory loss. Right? Many causes of memory loss, guys, that needs to be part of the workup before we can call somebody and say this is Alzheimer's. Because guess what? These other conditions are very fixable. B12 deficiency, that's fixable, isn't it? Vitamin B12 deficiency, right? Did you know that not having vitamin D, adequate vitamin D, can lead to memory problems? Yeah, there are at least 3 to 4 published studies linking low vitamin D with Alzheimer's disease. Because vitamin D does a lot more than just help your bones. Right? Vitamin D activates your genes and your genetics that promote brain health. How many of you guys know that you need vitamin D? Most hands are up, right? Alzheimer's is the number 3 cause of death in Orange County, guys. Make sure you get your vitamin D checked and make sure it's corrected. That's correctable, right? Easy stuff is correctable with that. I don't know why we're vitamin D deficient in Orange County. I mean, we sound like all over the place. We're still deficient. I don't know why. Sunscreen? Oh, okay. Sunscreen, or you stay indoors, or I don't know. If you're in Vietnam, I was in Vietnam a few weeks ago, medical missions work. People are walking around in the sun with like umbrellas, right? And I get it, right? I mean, we don't want skin cancer, right? We don't want that. But vitamin D deficiency is a risk factor for Alzheimer's. So, if you were seeing me for memory loss, the first thing I would do is do a memory test for you. Because if you don't look, how would you know it's even a problem? Right? If you don't look, how are you going to prevent Alzheimer's unless you even know and screen for Alzheimer's? How many of you guys, again, have had a memory test in the last year? Look around you. Just a few hands. If you're not looking, how would you know? This is why I'm here. You need to have a memory test once a year. Okay? If your doctor do not do it, just call my office, Irvine Clinical Research, no cost. If your doctor's not doing your memory test, it should be done. Why aren't we even looking for something that is the number 3 cause of death in Orange County? Why are we testing for it? Right? That's the problem somewhere there. A memory test is part of the annual wellness visit. You guys know what the annual wellness visit is? Right? A lot of you guys? So make sure you get your annual wellness visit. A memory test is in there. But your doctor needs to know what to do with the results, don't they? Other than tell you have memory loss. Here are some of the workup you should do. Number 1, get the memory test done. Okay? To see if it's a problem or not a problem at all. Oftentimes, we miss the diagnosis of dementia because we think that memory loss is part of what? Aging. Absolutely. This is why this is a misdiagnosed problem. We all assume we're getting older. So, it's like, I'm in my 70s, I'm in my 80s, of course I'm going to have memory loss. I'm old, right? That's an assumption that's false. That's an assumption that's false. Okay? So you got to get your annual memory test with your doctor or just call our office and get it. Now, if you do have memory loss on the memory test, there are a lot of things in your blood work that you can look at. Check your thyroid function, because hypothyroid, right, untreated, leads to memory loss. Thyroid. Check your thyroid function, right? TSH, thyroid stimulating hormone. Simple blood test, right? Check your vitamin D level, because there are at least 4 different published studies showing the deficiency of vitamin D is associated with Alzheimer's. And not only check it, but fix it if it's abnormal. Gotta make sure you get enough vitamin D, right? Very important. Check your vitamin B12 level. Vitamin B12 level, because a low vitamin B12 will lead to memory loss. Anyone here get the vitamin B12 check? Oh, yes, okay, well, handful, good, right? Check for inflammation. How do you check for inflammation, guys?
CRP.
There are some blood work. Yeah, the two most popular inflammation checker in your blood test is the ESR, which is the erythrocyte sedimentation rate, right? The erythrocyte sedimentation rate, ESR. The second one is the CRP, C-reactive protein. Simple blood test. It'll tell you if you have inflammation or not. Right? ESR and CRP. It'll tell you if you have inflammation or not. If there is inflammation, you don't just take an anti-inflammatory for it, right? You have to find out why it's there. If there's inflammation, why is it there? There are many causes of inflammation. Chronic disease, rheumatoid arthritis, lupus, right? There are many causes of inflammation. You should look to see why it's there and then fix it. Pretty simple, right? Check your blood sugar. Check your blood sugar if you have memory loss, because we know if you have diabetes or pre-diabetes, it doubles the risk of Alzheimer's. Make sense? These are things that can be checked in a simple blood test, isn't it? Right? Get that hemoglobin A1C checked, right? That will tell you you have pre-diabetes or not, or a fasting blood sugar. Okay? Because that's fixable, isn't it? With diet, nutrition, exercise. That's fixable. There are many things here that you can check, can't you? Easily. It's not like there's nothing you can do about it if you have memory loss. Oh, hemoglobin A1C. Hemoglobin A1C is the name of the blood test that looks for diabetes. By the way, I've admitted many patients in the ER who comes in with confusion and memory loss. One of the things I found that nobody looks for is silent urinary tract infections. UTIs. Anyone ever noticed UTIs can cause confusion? There's a few hands up, right? UTIs, yeah. Check a urine test. Make sure that that patient doesn't have a silent UTI. There's so many things we can do here, guys, for memory loss, besides calling it old age related, that are completely, potentially fixable. And then have your doctors look through all your meds and point out the medications that may interfere with your memory. Medications that may cause sedation, sleepiness, right? That can cause memory problems. And then you want to look and see if there are other health conditions that can mimic memory loss, such as depression. Did you know depression can cause memory loss? Right? Patients who are depressed, they can't concentrate. They're not thinking, their mood's down, and that mimics dementia and Alzheimer's. So look for depression as a potential cause of memory loss, because that's potentially fixable too, isn't it? By the way, check your hearing. Right? I've had so many wives bring their husband in. If you can't hear, you're not going to remember. Right? If you can't hear, you're not going to remember. That's fixable, isn't it? Hearing loss is a risk factor for Alzheimer's. That's completely fixable. It's called a hearing aid. fixable here? There's a lot that you can do, guys, besides just calling it dementia and calling it quits, right? This is all the workup that I would do, you know, at our office with that. Yeah. Homocysteine? Ooh, we're getting deep here. Yeah, that's a marker of inflammation, and it's treatable with folic acid if it's elevated. Homocysteine level is a little bit deeper. I mean, there are many blood tests that we can do. I'm just giving you the superficial basics that any doctor in primary care can do. Right? In research, we do a lot more than that. We go deep in research, and all the different labs and things of that sort. Right? We would check your genetics. And, by the way, how many genes are there that causes Alzheimer's?
2.
Anyone know? What's the most popular gene that's known to be linked to Alzheimer's? ApoE4. Anyone heard of that? APO, letter E, number 4. ApoE4 is a gene linked to Alzheimer's. And if you have the gene, you need to know that you're not condemned to the diagnosis. It doesn't guarantee you're going to get Alzheimer's if you have the gene. Why is that? Because lifestyle, right? Lifestyle plays a bigger role than the gene. Make sense? If you have the gene, it doesn't mean you're going to get it. Okay? Lifestyle plays a role. But on the other hand, if you don't have the gene, it doesn't guarantee that you won't get Alzheimer's. Why is that? Because lifestyle plays a role. Right? Lifestyle plays a role. There's a total of 75 genes. In your genome, there's a total of 75 genes linked to Alzheimer's. We knew about 33 of that 75 prior to last year, and last year we discovered another 40-something. This is why Alzheimer's is not a one-thing disease, right? There are multiple factorial reasons that lead to this diagnosis. It's not like once you wear an Alzheimer's hat, it's the same hat as everyone else. You have to identify your specific risk factors and address them. Right? This is why I call it precision medicine. If you see one patient with Alzheimer's, you only see one patient with Alzheimer's. They're not the same with the next patient with Alzheimer's because they have different risk factors to address. Right? It's not like there's one pill to treat every patient. You have to identify the holes in the roof and plug them. Make sense? Let me talk a little bit about sugar. Uh-oh. Talk about sugar. What is this area here? Actually looks pretty good. Let me talk a little bit about sugar, right? So, we know that diabetics have double the risk of Alzheimer's than non-diabetics. Sugar, right? Sugar. What does sugar do that makes it bad for the brain? Something about insulin, something about inflammation. Okay, it's kind of connected. So if you ate breakfast this morning, right? In the typical American breakfast, it's loaded with what? Sugar, right? Bagels, donuts, right? Pancakes, waffles. You're making me hungry, right? You're gonna ruin my fast there, right? So the first thing that happens is that your blood sugar does what? Goes up, right? Your blood sugar goes up, and your pancreas makes what to bring that sugar down? Insulin. Your pancreas makes a hormone called insulin to bring the blood sugar down. Make sense? And so that's the role of insulin, is simply to bring your sugar down. How does it bring the sugar down? Do you know? What does it do to sugar to bring it down? Does it just tell it to go down? Or how does it go down? What is the purpose of sugar? Glucose. Energy? Absolutely. Sugar is used by your body for energy. So in order for sugar to be used by your body for energy, that sugar that's in your bloodstream needs to go inside your cells. Make sense? Needs to go inside your cells. Have you ever been to a hotel where there's a doorman that stands and the sugar comes down because it goes inside the cell, right? And so by the time your sugar's starting to come down, it's mid-breakfast snack. What do you guys have for snacks normally mid-breakfast? Snacking on something, the sugar goes back up, and the pancreas, what does it do? It goes back to work, right? It makes insulin. And that factory is making a product. That product is called insulin. Make sense? The factory gets turned on, the pancreas, right? It makes insulin, brings the sugar back down. By the time the sugar is going back down, guess what time it is? Lunchtime. Because we only get the mid-breakfast snack. Right? It's lunchtime, you have lunch, your sugar goes up, your factory goes back to work, the pancreas, and it makes insulin to bring the sugar back down. Make sense? So sugar going back down. But the time sugar starts to go back down, guess what? Afternoon what? Snack. Yes. How many of you guys have afternoon snacks? Yes. Happy hour? That's late afternoon. That's late afternoon. Right? Unless your happy hour starts at 3. Yes? It does? Nice. Tell me where you go. Right? So yeah, by the time your sugar for lunch goes down, it's 3 p.m. happy hour, your sugar goes back up from happy hour, the factory turns on again, insulin's produced, right? Insulin's produced, and it brings down the sugar, and by the time the sugar starts to go down, what time is it? Dinner time. Dinner time. You have dinner, your sugar goes back up, right? The factory goes back to work. By the way, did the factory even get a break? No. It never got a break. Breakfast, snack, lunch, snack, dinner, afternoon snack, after dinner snack, dessert. This factory called the pancreas never gets a break, does it? The only time it gets a break is when you're sleeping, right? Only time it gets a break. By the way, if you have a factory and you make the employees of that factory work, from the time you wake up, breakfast, and it works all day, and your employees are working all day until bedtime, what happens to this factory over time? Wears out, goes on strike, burns out, walks out. That's right. The factory burns out, doesn't it? The factory burns out. What do we call a burnt out factory? Absolutely. We call that burnt out factory diabetes. 2 out of 3 Americans have a burnt out factory. Diabetes or pre-diabetes. Pre-diabetes means it's on the process of burning out. Now you know why this is an epidemic of diabetes. It's our lifestyle, it's what we eat, and it's how frequent we eat. We are burning out our own factory, right? We're burning out our own factory. Pretty scary when you think about it. Because everything here is lifestyle, not talking about. Not talking about magic pill to fix this, does it? So if we're burning out our factory and we're starting to lose our insulin, right? We're losing our insulin. Doesn't the brain need an optimal insulin factory to function? Doesn't the brain need sugar to function? Yes. Doesn't it? Right? And you don't fix it by eating more sugar. So we got this burnt out factory and we got all this sugar floating around. Because the sugar is not getting into your cells now because the doorman's not opening the door, right? We burnt out a factory. So there's sugar floating around. When there's sugar floating around the bloodstream, where does all this extra sugar go to, guys? Where does it go to? All this extra sugar. Fat, blood. It's in the blood. Where does it go? So there are 3 places that sugar goes to. Okay, 3 places that sugar deposits to when there's so much sugar from our lifestyle and our diet. The first place it goes to is that it goes to your liver. Sugar deposits in the liver, and it causes a condition called fatty liver. Anyone here heard of fatty liver? Right? Fatty liver simply means too much sugar. That's all it means. The sugar deposits in the liver, it converts to glycogen, which is this fatty storage, glycogen. That's all it is. So anytime you hear fatty liver, just think, too much sugar. In your lifestyle and your diet, too much sugar, right? Fatty liver. Why is fatty liver a scary thing? Why is it bad? Why should we even worry about it? Well, it causes inflammation of the liver. And when the liver is inflamed, it can't do its job, which is to detoxify toxins, right? Remember how toxins is related to Alzheimer's? When you have an inflamed liver, it can't do its job. It can't detoxify toxins. And when the liver is inflamed for a long time, it can lead up to a condition called cirrhosis. Anyone heard of cirrhosis? Right? A dead liver that will kill you if you don't get a liver transplant. So one of the most common reasons today for a liver transplant is fatty liver. It used to be not the case. It used to be hepatitis C. Right? Hepatitis C was a killer of cirrhosis, one of the number one reasons for liver transplant. But then we came up with clinical trials and we came up with medications. Now we got a pill that can cure hepatitis C by like 98%. So we took away hepatitis C, so now fatty liver is becoming very common. And it's leading to liver transplants. And your liver can't detoxify because simply you have too much sugar. But now that you know that, it's fixable now, isn't it? Fatty liver is very fixable. So that's the first place that too much sugar goes to. What is the second location where too much sugar goes to? Not kidneys, not brain. Second location, not heart. The second location that sugar deposits in is that sugar deposits into your fat cells. And it makes us what? Fat? Yeah. Sugar deposits to your fat cells and makes us fat. Yeah, sugar. It's interesting because forever when I was growing up, going through school, I was always taught that if you want to lose weight, if you want to lose fat, you go on a low-fat diet. Right? Lose fat, low-fat diet. Lose fat, low-fat diet. We're all taught that, aren't we? So if you're eating that medium rare steak, and that steak had a rim of fat around it, what do you normally do when you see a rim of fat around your steak? Cut it out, right? You trim it out because you're not eating the fat. I mean, how many of us cut out the fat in our steak that we saw? Just about everyone. So if we're all trained that fat is bad, and to cut out the fat in our diet, to cut out the fat in our steak, why is it that 2 out of 3 Americans are overweight? If we're all watching the fat in our diet. Because it's not the fat, it's the sugar. Nobody's watching the sugar. And when I say sugar, I'm not talking about, the obvious cookies, candies, ice creams, desserts. I'm talking about carbs. White rice, white bread, spaghetti, pizza, hamburgers, and the buns. Right? I'm talking about the American diet. All right. I'm talking about the American diet. We are all watching our fat. Nobody's watching our carb. Causes an obesity epidemic. 2 out of 3 Americans have obesity or overweight. 2 out of 3 Americans have diabetes or pre-diabetes. Why do they share the exact same statistics in America? 2 out of 3. Because sugar is the same driver for both. Make sense? That's the second place that sugar goes to. What's the third place that sugar goes to? Sugar isn't the only thing floating around in your bloodstream. What else is floating around your bloodstream? You got red blood cells, right? Red blood cells, white blood cells, your immune system, right? Plasma, you got lots of proteins floating around. Molecules, proteins, things of that sort floating around your blood. So what the sugar does is that it hitchhikes onto everything floating around. It's a hitchhiker. When there's so many of it, it hitchhikes. So what you see is you see a protein floating with a sugar tail. A sugar tail floating behind a protein, right? Or you see red blood cells with sugar tails on it. What do we call that? We call that the hemoglobin A1C. That's how we measure your last 3-month average blood sugar by measuring your red blood cell, the hemoglobin, and the amount of sugar attached to it. Isn't that crazy? Sugar tails, nobody ever told you that, did you? That's why it's called the hemoglobin A1C. It's the sugar tails we look at, right? Because a hemoglobin cell, a red blood cell, lives for 3 months. That's the lifespan of a red blood cell. And then it dies, and then another red blood cell replaces it. So when we look at the red blood cell and the amount of sugar tails on it, that's how we measure a 3-month average. Right? Every cell in your body has a birth date and a death date, a lifespan. Right? Every cell in your body, like the red blood cell, has a time of birth and a time to die. And that's turned on or off based on your lifestyle and also based on genetics. Right? Your skin cells, your hair cells, your heart cells, your brain cells, every cell has a birth date and a death date. That's called homeostasis, right? God created it for balance. Balance. When we go off balance is when we are in trouble. Right? Your bones. Your bone has bone cells, doesn't it? When your bone production of new bone cells versus the removal of old bone cells go off balance, you get in trouble. When you remove more bone cells than you can produce and you're off balance, what do we call that? Osteoporosis. Osteoporosis is simply an imbalance between the birth of new bone cells and taking away old bone cells. Right? Cancer is simply a cell that's not willing to die, but it should. Think about it. Breast cancer, what do you see? A breast mass. And that mass is there because those cells aren't willing to die when they should. Make sense? Lung cancer, you have a lung mass. Why is the mass there? Because those lung cancer cells are not willing to die as more cells are being grown. Cancer is simply an imbalance between the birth and death of cells. Make sense? Alzheimer's is an imbalance of the amyloid beta plaque. The production of the plaque is from our lifestyle. The 3 buckets, right? There's 3 buckets. The production of the plaque is from our lifestyle. Did you know there's a process of amyloid removal that's going on all the time? Think about it. If amyloid removal is equal to amyloid production, you would never have to worry about Alzheimer's. Right? If amyloid removal process is equal to the production of the plaque, you would never have to worry about Alzheimer's. The problem is production exceeds what? Removal. Make sense? Yeah, you don't hear this from your doctor, do you? Because they only have 7 minutes. That's right. They only have 7 minutes and they're late coming in from the golf course. I'm just kidding. I don't know. I play golf with my daughter Lizzie, and she beats me. I don't know where she is. Yeah. So these tails, these protein tails with the little sugar tail, there's a name to them. You guys ready for the name? It's a very long name. It's kind of scientific. Advanced glycation end products. Yeah, advanced like advanced, right? Glycation, Glycation. Glycation means the process of sugar attaching itself. End products, N like END, products. Advanced glycation end products, right? If you were to Google that word, advanced glycation end products, you're going to learn that, first of all, it's just a sugar tail. That's all it is. Advanced glycation end products, they're sugar tails. If you were to Google advanced glycation end products, you're going to find out that these sugar tails is the cause behind aging and chronic diseases. Why is that? It's the cause behind aging and chronic diseases. It's because your immune system is in your bloodstream, it's looking around, and it's like, hey, what is that thing floating there with a tail? I don't recognize it. It may have recognized the original protein, but that original protein has now changed because there's a sugar tail. It is no longer identifiable to the immune system. And when the immune system doesn't recognize something, guys, what does it do to it? It attacks it. And in the process of this attack, what is created? Inflammation. Are you seeing the connection here between sugar, inflammation, and Alzheimer's? Right? I'm making all the connections for you guys here. Because guess what? This is all modified lifestyle. This is all lifestyle related, nutrition related, right? Sugar tails. Yeah, just Google it sometime for fun. Advanced glycation end product. The causes behind aging, causes behind chronic diseases, because chronic diseases is also linked to inflammation, right? It's all kind of connected with that. By the way, all this insulin that's being produced, when the body makes insulin, the body needs a process to take away insulin, right? Because otherwise your body's full of insulin that never goes away. That can't happen, right? When the body makes new insulin hormones, there needs to be a process to remove insulin. There needs to be a process to degrade the insulin, right? So what do we call that, guys? What do we call the enzyme that degrades insulin? There's a name for it. What do we call the enzyme that degrades insulin? To take away all that insulin that's being produced. You guys ready? You ready to write it all down? We call it the insulin degrading enzyme. It's absolutely true. Put it in your phone right now, in your Google. It's called the insulin degrading enzyme. So let me ask you this. How many of you guys have cell phones right now that can do a search? That can do a search on something? Okay. So I want you to put in insulin degrading enzyme, because our insulin is so busy doing its work because it's always because of what we eat, right? I want you to Google insulin degrading enzyme, and I want you to tell me, besides degrading insulin, what else does it do? Besides degrading insulin, what else does it do with your cell phone? So let me ask you this. If we're on the American diet, and we're producing insulin from breakfast, snack, insulin from lunch, insulin for our snacks afternoon, insulin for dinner. If our insulin is so busy degrading the sugar, opening the door to take sugar in. If our insulin is so busy doing that, what is it not doing? It's not removing amyloid. Its second job. Which causes an imbalance of what? Amyloid production and amyloid removal. Do you understand now why having diabetes doubles the risk of Alzheimer's? Because you burnt out your pancreas, you're not making insulin, so who's going to degrade the amyloid? Right? Is it all making sense?
Yes.
Yes.
If we do intermittent fasting, does that speed up the recovery?
Oh, good question. Question of intermittent fasting. Question of intermittent fasting. By the way, real quickly, the pancreas isn't the only factory that goes to work and burns out when you eat. Your entire digestive system goes to work. Right? The gut starts in the mouth, goes down the esophagus, stomach, small intestine, large intestine. The entire gut goes to work. The entire gut is a factory. And not just the pancreas, the liver goes to work, the gallbladder goes to work, all the other organs that work with your digestive system. So it's not just the pancreas that's burning out. Right? You're burning out the entire gut system. And when you burn out your gut, and when your gut doesn't function well because it's burnt out, there's a name for that. Gutless? Nice. That's good. I like that. I like that. Gutless. Yeah. We call that leaky gut syndrome. Anyone ever heard of that? Right? Leaky gut syndrome. And that's like another hour, right? I can talk to you about that. Leaky gut syndrome is when your gut does not function well, and your gut's supposed to protect your body from all the junk, right? It's supposed to keep all your junk inside your gut, absorb the nutrients, absorb the good stuff. But when your gut is burning out, it starts to leak, it starts to allow bad things to get into your system. And as bad things are leaking into your system, the immune system, what does it do? It attacks it. In the midst of the attack, what is created? Inflammation, right? This is the connection behind the gut and the brain. The gut is responsible for the health of your immune system. It's responsible to protect your body against all the junk that may cause toxins and things of that sort. When your gut doesn't function well and it starts to leak, the immune system goes haywire and it starts to attack. We have inflammation. Inflammation is connected to Alzheimer's. Do you see the connection between gut health and brain health? Right? With that. So, how do you fix all this? If I want to solve the problem with maybe my pancreas burning out, my factory working too hard, what do you need to do?
Give it a break.
Stop eating? Change diet? Obviously, we got to change our diet. Rest. How do you rest? Stop eating? Because not to stop eating. We're not going to go on a fast. Not eating so often? Okay. I'll tell you what I do, okay? And you don't have to do this. You don't have to do this. By the way, this is education. This is not like I'm making a diagnosis for you. You got to talk to your doctor about all this, right? This is more education here. So what I do is I have lunch. My sugar goes up, my insulin goes up, things of that sort. I have dinner. My sugar goes up, my insulin goes up, right? The typical stuff. I wake up, it's breakfast time. For breakfast, I drink water. My next meal, lunch. My next meal is lunch. Okay? So, if my last meal is dinner, and let's say dinner is before, what time you guys eat dinner? 6? So early. 7? Okay, let's say for the sake of giving you some bandwidth, your last meal is before 8 p.m. dinner, right? After dinner, you don't eat food. Water's okay. And you wake up and your next meal is lunch, noontime. How many hours have gone by since you've eaten between dinner and lunchtime? 16 hours, right? 16 hours. I'm not saying you have to do this. How many hours have I allowed my pancreas to rest? 16 hours of rest. Yes, 16 hours of rest. How many of you guys are worried that you'll be super hungry if you don't have breakfast? Not a few hands. I mean, aren't we all taught that breakfast is the most important meal of the day, right? Yeah, sponsored by Kellogg's. So if you don't have breakfast, where's your energy coming from? Right? If you wake up and you don't have breakfast, is your sugar high or low? Low. Your sugar is low because you haven't eaten, right? If your sugar is low, the brain is going to be like, where am I going to get my energy from? Because I don't have sugar and he hasn't eaten breakfast. What does the body do next to get energy? What does it burn next for energy? Fat. When there's no sugar, the body burns fat for energy. Make sense?
Yes.
How many of us can use some fat burning? I've just shown you how. But the only way your body will burn fat is no sugar. That's the only way your body will burn fat, right? Is no sugar. By the way, it's almost noon already. You guys don't mind we go a little bit past, right? Right? And so the only way your body will burn fat is no sugar. If you have sugar, your body does not need to burn fat. Make sense? If your body burns fat for energy, what is the byproduct of that fat burning that's used for energy? The byproduct of fat burning that is used for energy.
Weight loss.
Yes, your weight loss, lose weight. But when you're burning fat, that fat burn becomes ketones. Ketones is the byproduct of fat burning. So your body uses ketones for energy. The ketogenic diet, right? The whole point of the ketogenic diet is to get you to a state of ketosis where the ketones that are being produced is used for energy. Does that make sense? So it's not like you lack energy. What you're doing is you are exchanging your energy source from sugar to ketones. Why is that important? There is some preliminary research that's been published. Very interesting. Preliminary, so this is not a medical recommendation, right? This is preliminary. I've seen several published reports already. Patients with Alzheimer's, memory loss, MCI, they were given ketone supplements. Why is that important? Because the brain needs sugar, it needs glucose for energy. When the brain cannot use it because you lack insulin, because of insulin resistance, because of diabetes, and we're burning out our pancreas, our brain is starving for energy. When the brain cannot get energy from sugar, it can still use ketones for energy. Isn't that interesting? Preliminary research. It can still use ketones for energy. In the studies that have been published, they have published patients using ketone supplements, MCT oil that breaks down the ketones, or different types of ketone supplements. They give patients this, and their memory got better. You know, I'm not saying it works for everyone because this is preliminary, but what I'm saying is that like a hybrid car that takes both gas and electricity, your brain can take both sugar and ketones for energy. When your brain can't use sugar, maybe you look for an alternative source for energy. Interesting, isn't it? Preliminary research with that. There's no dosage, there's nothing like that unless you look at the studies to find out the dosage. But these are preliminary studies that show ways to give your starving brain energy. Very, very interesting. By the way, I don't have breakfast, my sugar is low, my body burns fat to make ketones. Fat burn results in weight loss if you need to lose weight. Fat burn also does what to your cholesterol? Lowers your cholesterol. By lowering your cholesterol, you lower your risk for heart disease, right? And by making ketones, your body has an alternative source of energy which can feed your brain as well. Very interesting, right? Intermittent fasting. Early research. A lot of this is early research. Okay, in the last few minutes we have, let me give you 12 things you can do to reduce your risk of Alzheimer's by at least 40%. You guys ready? Since we are at noon, we can go on another few hours, but you know, I'll forget half of it, so will you. So let me pull up here 12 things you can do from that article in the Lancet. Remember, I told you the Lancet published 2 years ago and nobody was paying attention because we're all thinking about COVID. But an article published shows that there are 12 things you can do to cut down your risk of Alzheimer's by at least 40% with that. So here we go. Let me pull up that article for you now. Okay, number one, and some of this stuff is pretty obvious, guys. Number one, stop smoking. Stop smoking if you're a smoker. Right? Smoking is a risk factor because of which category? Toxins. Toxins category, right? That's number one. Number two, avoid pollution. Sure. I'm not suggesting you move or anything. Stay indoors forever, right? That's number two. Number three, keep your brain active. Those who keep their brains engaged have a lower risk factor for Alzheimer's than those who don't use their brains. What do I mean by that? It could be bridge, it could be Sudoku, word puzzles, it could be Scrabble, right? It could be chess, it could be checkers, and if we were in a Catholic church, it would be bingo. I know, you look at bingo, I keep hearing that, right? So keep your brains active with that. Studies have shown that those who have a higher level of education have a lower risk of Alzheimer's than those who have a lower level of education. It's not because they're smarter, it's because they spent more years keeping their brains active. Make sense? What was that, number 3? 4? Okay, good. I don't have to write one. Okay, next one. Physical exercise. Physical exercise. Like the study I just mentioned to you when we started this lecture, right? They just published a study that those with the diagnosis of MCI, mild cognitive impairment, which is pre-Alzheimer's, the natural course of MCI in many people is a decline over time into Alzheimer's. When they put several hundred folks onto an exercise program They exercise 30 minutes a day for 4 days a week. 30 minutes a day for 4 days a week. 1 year later, right? 1 year later, what they do is they measured their brain function and their memory and all that. 1 year later, they rechecked it. There was no decline in memory in those who exercised. Very interesting. And it's not a guarantee, it's a study, right? But compared to those who didn't exercise with MCI, there's no decline. Because when you're exercising, your heart's going, it's pumping and all that. It's pushing what to your brain? Circulation. The circulation bucket, right? Right? Smoking is the toxins bucket. Air pollution is the toxins bucket. Exercise is the circulation bucket. You see how all these treatments address a bucket?
Right.
Right? So exercise. So exercise 1, brain games 2, don't smoke. Number 3, engagement of the brain, right? Next, socialization. Socialization. Those who socialize, and socialization is basically this, right? Hanging out, talking to one another. Those who socialize on a regular basis have a lower risk of Alzheimer's than those who are home alone out there. Make sense? Probably because when you're socializing, these brain cells are what? Connecting. Right? You know how the brain cells, they all talk to one another? They're connecting when you socialize and you're interacting. Socialization, right? Next one, control your blood pressure. Control your blood pressure control, very important. We have found that those who have high blood pressure during their middle ages have a higher risk of Alzheimer's when they're older. Those who have diagnosed high blood pressure when they're in their 40s, 50s, and 60s have a higher risk of Alzheimer's when they're in their 70s and 80s. Control blood pressure. Why is that important? Because blood pressure is what bucket? Circulation bucket. Right? Next one. Control your sugar. We overkill that one, right? Control your sugar. Because as we have talked about, sugar is toxic to your brain. Sugar creates sugar tails, which creates inflammation because your immune system is attacking it, right? By the way, when you're fasting, when you're intermittent fasting and your sugar level is low, because you skip breakfast or you skip dinner or whatever it is, when your sugar level is low, do you have more sugar tails or less sugar tails?
Less.
Less sugar tails. And if you have less sugar tails, what happens to inflammation? You get less inflammation. Is this all connecting?
Yes.
Right? So, abstain from sugar as much as you can. And you can check for that. That's a hemoglobin A1C blood test, right? To see where you're at. And you substitute sugar. Well, what I tell most patients is natural sugar, I wouldn't worry about, like from fruits, right? I wouldn't worry about as much. It is the processed sugar, the white sugar. Not only is it bad, it's also a chemical not recognized by the immune system because it's processed. Make sense? All right. What number is that, by the way? 7, 8? I'm going to make a few more. Right? So, next one. Control obesity. Control obesity. There is an association with being overweight and Alzheimer's. Why is that? It's probably because obesity is connected to sugar, right? It's probably because it's connected to that. Did you know obesity is connected to 13 cancers? Yeah, that's another hour lecture for another day. Obesity is connected to 13 cancers, and I'll tell you the science behind it one of these days. Maybe we'll do it here or we'll do it somewhere else, right? But it's connected to that. Control obesity with that. Next one. I'm going to give you a list of foods. list of 10 foods that has been known to be helpful for the brain. You guys ready? Number 1, green leafy vegetables. Green leafy vegetables. So that is what? Kale, spinach. What choice not leafy? Is it? Oh, it is? Okay. I don't know, just green leafy vegetables. Number 1. Number 2, non-green leafy vegetables. Anything that comes out of the ground. Right? Especially the colorful stuff. Right? Non-green leafy vegetables. Beets, yes, there. Number 3, berries. Berries. What are your favorite berries? Raspberries, blackberries, strawberries, blueberries. Very high in antioxidants. Very high in antioxidants, berries. Which berry? Mulberry? Oh, is that a berry? Oh, I don't remember eating that. I don't remember eating that. Is that something you can buy? Okay. Number four, whole grain. Whole grain. The emphasis is on the word whole because it means fiber. Fiber. Fiber helps with your digestive tract. Fiber helps with your gut health. Fiber helps to lower cholesterol by lowering heart disease as well. It's good for your brain. Okay, fiber. Number 5, beans. Beans. What are your favorite beans?
Black beans.
Green beans, black beans, jelly beans? Jelly beans. Okay, beans. All right. Okay, that's interesting. By the way, what number are we at out of 10? 5? Okay. Okay. I'm just going off the top of my head here with my poor memory. Okay, next one is nuts. Nuts.
Nuts, walnuts.
Don't tell me you like nutty people. Just kidding. Walnuts, what else? Almonds, pistachios,
Cashew.
yes, Brazilian nuts, pine nuts. We have the most data actually on walnuts. Walnuts has the most data, but all the nuts are good. And it's not just good for your brain health. Nuts has a good source of fiber. It's a good source of good fat. Good fat. Because we've been taught to avoid fat, but the truth is you need fat. You need the good fat, not the bad fat, right? You need the good fat. So nuts is a source of good fat. Okay? Ooh, yes, olive oil is the next one. Olive oil, especially the extra virgin olive oil. Lots of data. Olive oil has good fat, right? And olive oil has a lot of good data for heart health, brain health. Avocado is good also. Okay, not on the list, but good. Next is fish. What is it in fish that makes it healthy?
Omega.
Omega what? Omega 3 fatty acid. Omega 3 fatty acid. High source of antioxidants. Omega 3 fatty acid. Okay? By the way, how come we never hear about omega 1, omega 2, omega 4, omega 5? Why is it only omega 3 we learn about? Kind of weird, huh? Yeah. Avoid omega 6, not that great. Yeah. So omega 3 fatty acid. Okay? By the way, wild fish versus farm fish. Why? No hormones? Yeah, I guess you can't. Yeah, no hormones. Because they can give farm fish hormones if they want to. Why else? The omega 3 from the fish does not come from the fish. It comes from the algae that the fish eats. And you can only get that with a wild. Make sense? Come from the algae that the fish eat. So wow is better. And then you can eat farm too, right? Just not as nutritious. It's better than no fish. Okay? What number are we at?
8.
9, okay. 9, poultry. Poultry is chicken, turkey, chicken feet, right? Right? Chicken feet, good for your health. Could be. We could do a clinical trial on it. You never know until you try it out. You never know. Right? So poultry replaces red meat in this diet. There's no red meat in this diet. Make sense? Yes. Number 10, last one before we close. And for some of you, this is probably your favorite one. A glass of red wine. How many of you guys is your favorite one? Yeah, I knew it. Right? A glass of red wine. What is it in the red wine that makes it healthy? Yeah, there's an ingredient called resveratrol. Yes, I right? Resveratrol. Resveratrol is found on the skin of red grapes. Found in the skin of red grapes. Very high antioxidant source. So, red grape. Resveratrol? Oh, don't even ask me how to spell it. English is not my first language. Resveratrol is R-E-S-E-V-E-R, I don't know, something like that, right? Yeah, I'm a Vietnamese refugee. So, resveratrol. Now, if you do not drink, please don't start. Don't leave here saying Dr. Trinh recommends I start drinking alcohol for my brain. I do not recommend that. If you do drink, 1 glass of red. No, not this size. Not this glass size. Yeah, maybe not here, maybe not here. 4 ounce maybe, right? Yes, and you can't save all your glasses till Saturday. That doesn't work. So the diet I just gave you is called the MIND diet, M-I-N-D. It is a diet that has been published in multiple research articles. And in one research article, this diet, and the way we do it is we put a group of patients on this diet, the MIND diet, these 10 groups of food, and the other group is the American diet. We follow both groups over a period of 10 years, or not necessarily 10, a number of years. At the end of those years, we stopped and we looked to see how many people developed Alzheimer's as a diagnosis in both groups. The group that was on the MIND diet, in one study, had a 54% less risk of developing Alzheimer's. They cut the risk of Alzheimer's in half with that diet. This is very doable, isn't it? Nowhere in my lecture did I tell you to take a pill. Hey guys, it's 12:15. God bless. Thank you.
Thank you everyone once again for coming, for participating, all our vendors.